Mental health care is out of reach for most South Africans. This, according to the South African Society of Psychiatrists, following a three-day congress which brought together psychiatrists from across Africa to delve into challenges faced by people living with mental illnesses. Startling figures reveal that up to 92% of South Africans living with mental illness never receive treatment, a statistic experts warn has devastating consequences for individuals, families and society at large. The South African Society of Psychiatrists, SASOP, says this is not only a crisis of resources but also a crisis of excess. Dr. Siki Gwanya-Mdletye, who is the chairperson of SASOP 2025 Congress, joins us live now. Dr. Gwanya-Mdletye, thank you so much for joining us. Really do appreciate it. The very first time I had to consult with a psychiatrist, I was put on an 8-month waiting list. And that is just for an initial consultation. That is before any medication or any diagnoses had been rendered, and it cost thousands of rand. The medication there on top was equally, if not more expensive. And I'm a middle-class South African, and I felt the cost thereof. I can't imagine that most South Africans who do not have the resources but need to access psychiatric services are unable to do so. Just how big is the access gap in South Africa?
Thank you, and thank you for having me. And thank you, and thanks to your listeners as well. So I'm so glad that you've started with the example that you did of yourself and your own personal experience. I completely get the frustration that you probably experienced. And a lot of the time, this is what we sit with. We find that when people are in crisis, when people are, in distress and require to be seen by psychiatrists or mental health professionals like ourselves, sometimes the access really becomes an issue. And the reason I like your example is because it illustrates how mental health care access is not only a crisis for people who are uninsured, who are not on medical aid. In fact, across the board in South Africa, access to mental health services is, to varying degrees, a huge issue and a huge crisis. The World Health Organization in their studies usually say that you need to have at least 3 psychiatrists per 100,000 population. In South Africa, we're sitting at less than 0.3 psychiatrists per 100,000. So this means that we're less than a third of the way in terms of coverage, and the numbers look even worse for other mental health services, for instance, psychologists and the like. So we have a crisis in terms of availability of clinicians to see people with mental illness, and it's not necessarily getting any better. So the crisis is there, the crisis is real, and this is why in the Congress that you mentioned, our theme has been around reimagining mental health care access.
So let's for a second delineate between access to mental health services in general and access to very specifically psychiatric clinical support, right? The difference there for me is quite important because on the one hand, we can talk about therapeutic actions or services that could be supplemented one way or the other through primary healthcare interventions, peer counseling, group counseling, and other means that have proven to be effective. But psychiatric services cannot, because that is essentially a medicinal there's a medicinal link to it. And if it's in the instance of somebody who's suffering from a severe mental illness, whether it be psychosis, whether it be bipolar or neurodivergence of any sort, you can't just see randomly, you can't join a support group for that without having seen a psychiatrist first. So that gap needs to be filled somehow. In what ways can we supplement the clinical exercise in ways, in the medium term at least, without having to say, hey, we need to produce 10,000 psychiatrists every year?
Yes, which we obviously cannot. So we're seeing collaboration as being a very important aspect of dealing with the access gap. We're seeing collaboration as being important both on a smaller scale and on a large scale, and collaboration across the multidisciplinary team of professionals who see people struggling with mental illness. You know, most of the time when you have an illness or when you feel that things are not quite well, the first person you'll go to is your GP, isn't it? And general practitioners, we find, actually a lot of the time sit with patients who need to be seeing psychiatrists for a long time, managing them from their general practitioner practices, for better or for worse, during that time whilst they are waiting to see psychiatrists. And this is true both in the public and in the private sector.
Are you saying that
An
GPs,
important tool.
Doc, are you saying that GPs can play an important role in supporting the pharmacological element of psychiatric services?
Absolutely, absolutely. And we feel that if GPs feel adequately skilled to treat mental illness at a primary level, it does two things, right? Firstly, whilst one is waiting to see a psychiatrist, they are already initiated on treatment. The general practitioner is able to monitor the effect of that treatment and at least at a primary level contain that situation.
Yeah.
So we find that it is very important for even general practitioners to feel competent. And this is why, for instance, with our Congress this year, we've included a training element, which was happening today, interestingly, where general practitioners who want to be skilled in mental health can complete training in what we call the diploma in mental health, and become and upskill themselves in the management of mental illness. Yeah. So we're seeing that even that kind of collaboration as being very important, and upskilling, because when you talk collaboration, when you talk task sharing, and I think this concept really of saying, if we can spread out our expertise to people who are appropriately trained, and in this instance, GPs and general practitioners are appropriately trained, because in South Africa, we all at least have a Bachelor of Medicine, Bachelor of Surgery. Yeah. And part of that training requires that one does some months doing rotations within psychiatry and see and getting familiar with psychopathology. So what we're saying is strengthening the skills, of the clinician who comes in touch with the patient first. So GPs, mental health nurses, because in the primary setting, particularly in the public sector, clinics, primary care clinics, are run by nurses, right? And nurses have dispensing license. Nurses are trained and are able, for instance, in the clip you played before, of course, nurses are useful for we're seeing nurses treating.
Yeah, nurses, of course, are also useful for initial diagnostics, given that they're more likely to see a patient than doctors are able to. Unfortunately, we've run out of time, Dr. Gwanya-Mdletye, but thank you so much for coming onto the program. Really do appreciate it. That is the chairperson of the SASOP 2025 Congress, Dr. Siki Gwanya-Mdletye.